but if not, I'll tell you what it is. There was a little girl and her sister were playing in their yard, and they had contact with a wild dog. And about 5 or 6 days later, she came into the emergency room at the hospital in the middle of the night, confused. Her spinal tap was okay, and her malaria smear was negative. And the next morning, the pediatric PA asked me to come and see her in their clinic. So I went and talked to her mom, and then I asked the pediatric PA to give her a cup of water in a plastic cup. I don't know if we have that video. No, okay, sorry. What it shows is the little girl can't swallow the water because she has laryngospasm from rabies. So we gave her a little morphine and a little Phenergan, and she passed away peacefully later that night. When you work in a third world country, as many of you have done, you know you cannot save everyone. But what you can do sometimes is to make their exit a little more peaceful and a little graceful. As physicians, we have a unique opportunity to help people. But I would also say there are a lot of other needs in every community. There are many things that we can do. United Way, Boys and Girls Clubs, St. Vincent de Paul. There are many organizations that we can support. And all those little steps make things better for everybody, just a little at a time. Thank you.
Thank you, Peter. Thank you for reminding us, we often think about the science of medicine, but fundamentally medicine is really, it's a human interaction, that human interaction, caring for others, and your demonstration of that both locally, but also the impact that our school has globally. So thank you for reminding us of that important element of medicine. It really is about that human-to-human relationship and that compassion. The Alumni Early Achievement Award honors an alum who trained at the School of Medicine within the last 20 years and has excelled in their career, making significant contributions to public health through clinical care, medical science, research, humanitarianism, or administrative activities. The recipient of the 2025 Alumni Early Achievement Award is Dr. Ruan Barnabas. Dr. Barnabas is recognized as a leader in implementation science, clinical research, mathematical modeling, and health economics. Following her fellowship in infectious diseases at the University of Washington School of Medicine, Ruan moved quickly through the academic ranks to full professor. She served as director of UW's Health Economic Impact Studies for Translation, or HEIST, program in the Department of Global Health, where she also directed the Center for AIDS Research Developmental Core and the International Clinical Research Center. The breadth and depth of Ruan's strong record of research are notable, having made significant contributions in the treatment of HIV, HPV, cervical cancer, and COVID-19. Her recent Kenji trial demonstrated that a single dose of HPV vaccine was as effective as a multi-dose sequence, a truly pivotal finding that immediately changed global vaccine policy and is considered a game changer for cervical cancer prevention. And her work on the implementation of testing and treating HIV in resource-limited settings has resulted in greater viral suppression and increased access to care. Beyond her research, Dr. Barnabas is deeply involved in mentoring junior trainees and is widely respected and admired by pre- and postdoctoral students, as well as fellows and junior faculty. As one colleague notes, she has the ability to do science at the highest level, but do it in a way that inspires all those around her. She is truly a model for successful multidisciplinary and team science, particularly for growing diverse global next-generation leaders. She is deeply accomplished and widely celebrated for impactful research and leadership, and was the inaugural holder of the King K. Holmes endowed professorship in the Department of Global Health at the University of Washington. Tragically, we could not keep her at the University of Washington. This is my own bias here. But she does now serve as Chief of Infectious Diseases at Massachusetts General Hospital and as professor for the Harvard School of Medicine. Let's take a closer look at Ruan's story.
My mom was a physician, my dad is a scientist, and growing up in a household where we answered a lot of questions and discussed the science around those answers, certainly sparked my interest. And it just gave me a real appreciation for the scientific method and how you use data to generate hypotheses and test them and answer questions. And I thought that if you could bring these two things together, the rigor of science and generating evidence to advancing public health, that would really be the best of both worlds. I did my infectious disease training at the University of Washington, which was a transformative experience in my education and led me to a lifelong passion for infectious diseases, solving complex problems, teaching students, caring for patients, and building community. So I had really terrific mentors, starting with Judy Wasserhait, Professor Connie Kellum, and Professor Jared Baton, often going well above what you would expect a mentor to do, not only of my scientific training, but also of leadership training and then leadership opportunities, for which I'm immensely grateful. I joined the faculty after my infectious disease fellowship, and I think there's no better case for all the structures in place to help faculty develop. I joined the RISE program through the Department of Medicine, which was eye-opening, and it was so well done, done with absolute commitment to trainees. I have been just honored to work in global health with really strong partners. We worked on a suite of studies that have focused on community-based HIV treatment, for example, where people receive care in the community, either at community centers, in mobile vans, or in their homes. We did a very exciting study with Amazon where we delivered medications at people's home using an app. All these things make care more accessible. Part of the job that I love the most is seeing in each person the unique skills and potential that they bring to projects and thinking about how it all weaves together. There is just something that's very special about working together to solve really complex problems that no single person can do, that is quite compelling about science. I spent a lot of time understanding the epidemiology and the pathogenesis of cervical cancer, and with observational data on the effectiveness of single-dose HPV vaccines, we tried to find an elegant way in which we could demonstrate efficacy of the vaccine. The purpose of the Kenshi trial was to evaluate, does single-dose work, and does it work for adolescents and young adults? We were able to implement the study and stay on time despite the COVID-19 pandemic, demonstrate very high efficacy, which changed the WHO guidelines in 2022. And since then, 18 million girls who would have otherwise not been vaccinated have received the HPV vaccine. So one of the main things that I do is encourage people to work on things that are going to have large impact. I'm very proud of the work that we have done. It's quite a lot of intellectual work, but I'm very proud that we're able to help governments and institutions understand that investing in health overall has benefits for populations.
On behalf of the University of Washington School of Medicine, Alumni Association, and UW-Medicine, I am pleased to present the Alumni Early Achievement Award to Dr. Ruan Barnabas. Ruan.
Good evening, Dr. Delit, Dr. Chen, honored guests, colleagues, family, and friends. Thank you, Tim, for your kind words, and to all of you for gathering this evening to celebrate the remarkable University of Washington medicine community. That special place between Puget Sound and Mount Rainier that we, as alumni, carry with us. It's a beautiful bluebird day today, reminding me of the day that I decided to become a fellow in the infectious diseases training program, perhaps thinking that all days were going to be like this. But what truly sustains us through the gray skies, though, are the extraordinary people that are here in this very special community. I am deeply indebted to my mentors, Connie Kellum, Jared Baton, Haiti Frandroyan, Judy Wasserheit, Anna Wald, Nellie Mugo, King Holmes, and many others, whose scholarship I long admired before I arrived, and from whom I continue to learn. I'm grateful to my brilliant colleagues and friends, Helen Chu, Holly Janes, Elizabeth Brown, Jennifer Ross, and our exceptional team, Megan Crows, Kate Heller, and many others. I actually lie awake at night thinking about the work that you do. It is really exciting to be on a team with you. I want to thank my patients and trainees who have taught me immeasurably. Grace Umetese, congratulations on your graduation. Christine Hathaway, Sydney Klein, and many others. Learning is a lifelong journey, really enriched by our patients and our trainees. At UW Medicine, providing an environment where we all flourish has played a foundational role in our accomplishments. In this moment, we might think, what is the role of academic medicine? And at its heart, it is such a privilege. We meet people where they are. We use science to solve complex problems. We conduct bench-to-bedside research, teach, and build strong communities. What could be better? Last, but always first in my heart, I want to thank my parents, my dear dad, Alban, who is watching online from Cape Town at 5 a.m., and my dear mom, Malitha, who is no longer with us. They would be so proud. I want to thank my incredible husband, Morgan, who's full of energy and is always there to be the other half that I need. My dear children, Zamo and Didima, my brothers, their families, my extended family, thank you for your boundless love and support, especially when I'm working on yet another holiday. I am profoundly grateful to UW Medicine and the Alumni Leadership Council for this great honor. These awards send a powerful message, an unwavering support and commitment to excellence. I am forever proud to be part of UW Medicine.
Yeah, I mentioned Ruann was the inaugural holder of the King Holmes Endowed Professorship. King, really was the father of sexually transmitted infections. He put Seattle on the map for infectious diseases. That's why we are the place for infectious diseases. It's due to King. And King recently passed away. In fact, we have a celebration of life on June 16th for him. And I have no doubt, King is incredibly proud looking down. And Ruann, just let us know when you're ready to come back from the East Coast. This Boston, they have some issues out there, I'm seeing. Anyway, just let us know. All right. Man, those Kleenex. No one brought the tissues tonight. Okay. On behalf. The Distinguished Alumni Award recognizes an alum whose professional achievements and cumulative contributions have brought personal distinction, enhanced the general health and well-being of the public through professional practice, research, or public policy, and brought honor to their alma mater. Tonight, I'm pleased to present the Distinguished Alumnus Award to Dr. Christopher Flowers. Dr. Flowers is a prominent oncologist and researcher known for his expertise in hematologic malignancies. He currently serves as a chair of the Department of Lymphoma and Myeloma and head of the Division of Cancer Medicine at the University of Texas MD Anderson Cancer Center. Chris has made groundbreaking contributions to understanding and addressing cancer health disparities in lymphoma, uncovering how racial, ethnic, socioeconomic factors influence disease presentation, incidence, and outcomes. His research has provided critical insights into the etiology and clinical manifestations of racial differences in lymphoid malignancies, significantly advancing the field of disparity research. He has led influential cohort studies that enhanced understanding of risk models, clinical outcomes, and survivorship among diverse populations of lymphoma patients. Dr. Flowers has advanced therapeutic options and improved patient outcomes in lymphoma through clinical trials, personalized medicine, and health services research. His work has contributed to reducing treatment-related toxicities, the development of surrogate endpoints, and the adoption of evidence-based therapies. Through his research and numerous national and international collaboration, he has produced more than 400 peer-reviewed publications. Importantly, though, beyond his research and clinical achievements, Chris has shown a deep commitment to mentorship and education, supporting the careers of junior investigators and underrepresented minorities and women in academia. Let's take a moment to learn more about Dr. Flowers' life and his career in this video.
University of Washington was at that time and still is one of the preeminent places to train in internal medicine. I still think one of the best places on the planet, both in the care of patients with lymphoma and blood cancers, and in particular in stem cell transplantation. I have a long-standing history of role models and deep connections to the University of Washington. Both of my parents are alum, Mickey and Bob Flowers. My aunt, my mother's twin sister, Vicki Fabre, is an alum. Seattle and UW is a place that will always be home. And so it is extraordinarily meaningful to me to receive this alumni award and recognition of the impact that I've had on a career as a result of being a University of Washington graduate. And that really changed my life in terms of the directions that I was able to go. And it was the training at the University of Washington that launched my career moving forward. My work really is focused on the care of patients with lymphoma and doing clinical and translational research in lymphomas to try and better understand better ways to care for patients in the future. But also in my administrative roles as the Division of Cancer Medicine, I oversee the largest division at MD Anderson. From my perspective, academic medicine is the greatest career that you could possibly manage to pursue. It's continuously an opportunity to be able to engage with patients and with research and education in ways that are always fulfilling. One of the therapies that we've worked on is the development of CAR T-cell therapies or chimeric antigen receptor T-cell therapies. But one of the challenges that we've seen in the United States is only about 20% of patients who are eligible for that potentially curative therapy can actually get access to it. So we've been highly engaged in trying to understand the factors that influence access to care. And we know that patients who are diagnosed with lymphoma who come from rural environments are less likely to be cured of their lymphoma and have shorter survival than other patients with lymphomas. The Leukemia and Lymphoma Society has been a partner in some of this work, and we have a large grant to be able to study those issues of access and hopefully turn those into policy that can help to change access for patients. I also am very proud of my mentees and those that I can now see making an impact on the next generation of cancer care. And through a large number of programs that I've been involved with through the Lymphoma Research Foundation, the Scientific Research Mentoring Program, the American Society of Hematology, and the Clinical Research Training Institute, and other programs have now had impact on literally hundreds of clinicians and investigators who we're now seeing making major strides in the ways that hematology and cancer care are being delivered, and making new research advances that will impact patients in the future. And so it's great to see the breadth and depth that mentorship can have, and impact that it can hopefully have on the field in the future. I've been exceptionally fortunate to have outstanding mentors, in particular mentors from the University of Washington, Ollie Press and Reiner Storb, who were extremely influential in shaping my career, helping me to drive towards the success that I've been able to achieve in oncology. The UW clinical community really provided me with the fundamentals for providing research-driven patient care in a way that is compassionate. And I learned that deeply in the UW system through care at Harborview Hospital, through care at the University Hospital, and care at the Fred Hutch.
On behalf of the University of Washington School of Medicine Alumni Association and UW Medicine, I am pleased to present the 2025 Distinguished Alumnus Award to Dr. Christopher Flowers.
Great. Well, it is really quite humbling to be named as this year's recipient of the University of Washington Distinguished Alumni Award. And as I reflect on my career journey, University of Washington has a profound impact on what got me to the place where I am today. I'm a Seattle native. I was actually born in Doctors Hospital here, as was my father. Hospital that doesn't exist anymore, part of Providence Hospital now. And I have many to thank across the years that I spent here in residency and internship, through the Robert Wood Johnson Clinical Scholars Program, through the program in the School of Pharmacy for Pharmaceutical Outcomes Research and Policy, and through the Fred Hutch. But I will keep it short just because I know that all of you want to get back outside to fellowship and enjoy the limited nice weather that you have here in Seattle. And I also have a flight to catch. I'm actually running I'm running a conference in New York currently in cancer disparities, and need to get back to that directly from this program. But there are a few that I would be remiss not to thank tonight. And first among those are my parents, Mickey and Bob Flowers, and my other parent, Vicki Fabre, my mother's twin. There's lots of twins in the audience tonight. They are all UW alumni, as is my wife, Nicole Flowers, who is a pediatrics alumni of the UW program. And they've really been my rock and foundation for all of the work that I was able to do in my career, helping to establish that foundation that was necessary to pursue. I also would like to thank the Alumni Association and my nominators from the MD Anderson, Julia Joretta, our Chief Scientific Officer, and one of my mentees, Ong Lee, who helped to put forth this nomination. I think for many of us as academic medicine, 2025 has been a challenging year in terms of the ways that we face academics and the careers of academicians going forward. I have a little bit of a struggle with that because 2025 has actually been a pretty good year for me. Just in the month of April, I received the AACR award, Jane Cook Wright Award for Mentorship. Just last week, received the American Society of Clinical Oncology, John Von Rohen Award for Mentorship, and now receiving this Distinguished Alumni Award. But I have much to credit my early mentors at the University of Washington for that mentality of wanting to pay it forward in terms of what mentors can bring to a career. Ollie Press, the late faculty member who was shown in the presentation, a key individual in driving my career forward. Much like many of the other alumni award winners tonight, I was a primary care resident at University of Washington in the residency program. It was really in my very last month of internship and spending time with Ollie Press on the oncology wards that I learned the compassion that can be provided to cancer care patients at the time when there is nothing more that you can do to be able to cure their cancer, and what you can do to help both them and their families to live out the ends of their days in ways that are meaningful. But also the thrill that you can have in ways to provide immunologically driven care, leveraging our research to be able to cure patients, and now to be able to take things that were no longer curable at the times that I was resident, and now translating cures for those patients with novel therapies like cellular therapies and CAR T-cell. I'd also like to thank Scott Ramsey, who was critical in teaching me the ways to design and conduct clinical research at the highest level in ways that translate evidence into new practice-changing models of care for patients, not only the patient that's in front of you, but also patients at a great distance across the United States, in providing evidence-based clinical practice guidelines for the American Cancer Society, for the other groups like the groups across ASCO and other major guideline committees. And finally, I would like to thank Rainer Storb, who was truly critical in showing what lifelong learning means. Rainer, as you saw on the slide, was one of the very first fellows at the Fred Hutch with Don Thomas in 1968. And I'm hoping to come back to Seattle in a couple of weeks to see his retirement from the Fred Hutch in his 90s now. Rainer is one of the longest funded cancer researchers in the history of the National Cancer Institute, and really has been a lifelong inspiration in what it means to be a lifelong learner and to have a career that is driven by dedication to translational research. And so through the work that I've done as both a resident and a fellow at the Fred Hutch, that really has inspired me to drive the kind of research-driven patient care that can transform care with the goal to truly make cancer history. And so I'm deeply thankful to the Alumni Association for this award, and thank you all.
Thank you very much, Chris, and really just being a model of that integration of research, education, clinical care, the focus on underserved communities. How do you change those outcome differentials that you see? I mean, that you are what academic health systems are all about. Now, we do still have the Fred Hutch here. If you ever get tired of Texas and all that sun, maybe you need a break every now and then. I don't know. But thank you for the impact that you're having. And I also want to just take a moment when you talk about the mentorship, and I'm so pleased to hear about those mentorship awards. That is power. That is impact on the future. That in many ways is more meaningful than anything. It's really helping to guide that next generation. So thank you for all of your efforts, and congratulations on all of those awards. Congratulations to all of the award winners of this evening. I'm incredibly proud of the work that you do for your patients, communities, and the medical profession. I mean, for me, just listening to you, it just reminds me just the impact and what an amazing place our school is. And it's because of the people. It's because of the people who we've honored this evening and the rest of our community. So thank you. You really are an inspiration. And now I'd like to invite Angela back to close out tonight's program.
Well, thank you, Dr. Dellett. And this was really an amazing evening to celebrate our distinguished alumni. And it's really a start to a really wonderful reunion weekend. I think we've heard a lot about having pride in our school, and you all have now heard me talk about how much pride I have in being a Husky. And I think we heard that from all of our award recipients. It is an amazing thing to be part of this university. I love that we have people here celebrating 75th year reunion and 10th year reunion and everything in between. And so what I would say is, what we heard was this is about connections. It's about fellowship. It's about who taught you, who you can teach. And so what I would say is let's really commit to staying connected. We have these big reunions every 5 years, but it doesn't mean that in between we can't stay connected. So I would encourage everyone, reconnect with your classmates, make friends with other people. I'm so excited. I'm a talker. You all are in trouble tomorrow. Whoever's coming to dinner, I'm going to come find you. But again, congratulations to all our inspiring recipients. I'm always so proud to be part of a school that produces so many amazing physicians, and we are all amazing physicians, truly. We inspire each other to be the best, and we're all going to continue to serve to the best of our ability and be inspired by those who have gone up and beyond what I could ever have imagined. So now I'm going to let you all free to enjoy the rest of the evening and hopefully have a wonderful weekend. So thank you.